But new this morning, the month of April is known for a lot of things. Tax Month, Autism Awareness Month, and even Alcohol Awareness Month. But one condition that some may not know is about hypoxic ischemic encephalopathy, or HIE. Now, it's a condition that affects preterm and full-term infants caused by oxygen deprivation during fetal development, labor, delivery, or even the postnatal period. According to the National Institutes of Health, HIE happens in about 2 of every 1,000 births in developed countries, and the vast majority, between 80 to 90% of those cases, are not preventable. Now, roughly 40 to 60% of affected infants will either have severe disabilities or die by the age of 2. The NIH says there are many causes of the condition, such as a uterine rupture, placental clotting, or abruption, or in rare cases, umbilical cord issues. According to Hope for HIE, diagnosis in newborns is made after a physical exam, the so-called Sarnet scale, plus imaging such as an EEG and or an MRI. All right, some of the symptoms of this include low or absent heart rate or breathing, seizures, very pale or blue skin color, or floppy muscle tone, or even acidosis, or even failure. HIE often leads to diagnosis of cerebral palsy, epilepsy, learning disabilities, as well as several other developmental challenges. Now, there's no cure for HIE and no treatment is 100% effective, but the one most widely used is therapeutic hypothermia, or cooling. It has been shown to reduce death and disability in many cases. Depending on the case, the treatment can be done by a simple cooling cap or over the entire body. However, other medical intervention may be required to support the child's organs or treat any seizures as they recover. Of course, as the child gets older, they often discover what it's like to do like that, just like any other kid their age, even if they may not seem to fit the mold.
What's the next one? It is a Apatosaurus. What's the next one? Elasmosaurus. Good job.
HIE Awareness Month launched back in 2016 as a way not only connect the families whose children are impacted by the condition, but to advocate for more research and treatments.